Welcome everybody. It's Wednesday evening and here we are again doing another session with Discovery Health. I'm Dr. Kelly Felmer and I am really happy that you all keep coming back and joining me. Now, each time that we get together every single week, I'm trying to bring new topics. I'm trying to get you better educated. I'm trying to spark an interest in different things. Hello, Karina. Nice to see you here. So I know a lot of you who follow me have Hashimoto's thyroiditis, and I've thrown out a lot of different reasons in the past of why we get autoimmune disease, what triggers it. And so we've recently been talking about iodine. Right, Christy, hi Annie, hi Becky, and iodine has been quite the hot topic, so thank you everyone for listening, for sharing the videos, and for asking lots of great questions. Hi Wheezy, hi Stephanie. But tonight we're going to talk about viruses, and there is a lot of stuff to know about viruses, but I'm going to do my best to give you some information to try not to overload you, but just to help you understand, oh, that's how it works, or wow, that could be one of the reasons that I got Hashimoto's, or why I have this autoimmune disease. So specifically, we're talking about viruses and autoimmune disease, but thyroiditis is going to be a hot topic, and I'm also going to throw in some correlations to some other autoimmune diseases as well. Hey, Becky. So thanks everybody for joining. Always appreciate the thumbs up, and don't forget to share the videos. So I really appreciate you sharing them because it gets the message out to more people than I can reach by myself. Hi, Jill. So I really appreciate you doing that. I am going to switch over my screen here, guys. And now we're going to talk about viruses and autoimmune disease. So remember, when I do a presentation like this, I can't see your questions as they're coming through, but I always do my very best to go back and to address some questions that you may have asked if you are watching it live, or even if you're watching it later. When I look back, I always look to see if there's some new comments. So write lots of comments. I love to see them there about what we're talking about at the time, and please ask your questions as well. And so as we start, remember that there are a ton of autoimmune diseases. So the column on the left here names some really common ones: rheumatoid arthritis and Hashimoto's, both of which I suffer with, Crohn's disease, MS, lupus, scleroderma, diabetes, insulin-dependent diabetes specifically, celiac, fibromyalgia, even Parkinson's disease has now been thrown into the autoimmune disease category. It's so frequent. 1 in 12 people, 1 in 9 of those people are women, and it's double the number of people with cancer. Everybody's afraid of cancer because, of the detrimental effects that go along with that. But look at how your body is being broken down and how your immune system is trying to defend you and fight off these other diseases. We have to start focusing on the causes to decrease this number, this frequency, this prevalence. A woman is 8 times more likely to get an autoimmune disease over breast cancer. Ugh. So let's take a look at what we know about viruses. They're really tiny. They're infectious. We've all had a ton of them. They are incomplete organisms, so they actually have to get inside one of your cells. And I'm going to show you that in a little schematic, a little animation in a minute. But I thought this slide was great. When I've done research on viruses of all different types, I've got a lot of different literature. Some of it I have referenced, some of it I do not. But this is perfect. What medical research has not yet uncovered is that the body never attacks itself. That's a big bugaboo for me when we talk about autoimmune disease. And the first thing you read is it's just the body attacking itself. We don't know why, and this is what is happening. No, that's wrong. There is always a reason. Okay? Doesn't mean we can always reverse the reason. Doesn't mean we can always for sure find it out. but I'm giving you a lot of different reasons that could have sparked your autoimmune disease, and you have to try to find the cause if you want to change the illness. That's what I'm all about, changing the illness, reversing your autoimmune disease. I love it when I get to meet a person who is just starting down that autoimmune road, because we've got a great opportunity to change it, because the causes are fresh. We need to get rid of them. We need to calm them down. We need to work with the immune system, and we can change that person's long-term prognosis by working on things now. So anyway, it's not just the body attacking itself. There's a cause. Antibodies are signs that there's a virus or a bacteria or something that the body has prompted a defense against. And so if we talk about thyroiditis, there's TPO antibodies, there's thyroglobulin antibodies, and if you have Graves' disease, you have TSI antibodies. So your immune system makes antibodies to fight something, that destructive process that's occurred. So inflammation starts, triggers and messaging gets started, there's signaling, but the viruses often go undetected. One, they're usually not looking for viruses, but two, unless it's an active current infection, it's really hard to find them. And we're going to talk about that. So this picture just gives you an overview of all different kinds of viruses. And there are, I don't know how many, truly, viruses out there, because there's always new ones. They're always changing. Every year they change, they modify, they replicate, they adapt to what's going on. So viruses are known for that and very, very good at doing that. So this just gives you some basic idea of why sometimes you get a runny and stuffy nose. Sometimes you get a sinus headache. Sometimes you get a sore throat. Sometimes you get a cough. Sometimes you get sick to your stomach. And it's all different viruses that attach to different cells in different parts of your body that make different symptoms, okay? But this is what you really need to understand. Virus is a Latin word for toxin or poison. So viruses poison us, essentially. And this is exactly what happens. This little guy right here is an example of a virus, okay? And it's showing a cell with a DNA. Now, what's key here, although most viruses look different than this is one particular type, you'll notice that he's got some DNA or RNA of his own, and it's this pink stringy thing that he injects into this cell. And the cell's original DNA is this green circle, okay? I hope you're all following me with that. Look what happens in this third cell. What do you see? You see a ton of little purple or red squiggly things in there, right? And the nice green circle DNA has been completely destroyed. The virus DNA or RNA is replicating and replicating and replicating until it replicates so much to the millions or the billions or the trillions that it explodes. Okay? That's exactly how a virus works. So when you start to feel a little bit ill, something's happening, and then when you have full-blown symptoms, imagine all of these viruses have just replicated and trillions of them are floating around in your system. So your body's got to get that back under control to squash down that virus, and now your symptoms go away. Okay, just think about that now as we start talking about the autoimmune disease and what's happening. Because why do we need to talk about viruses? Most healthy people don't experience too many symptoms when they get infected with a virus. Okay, and this slide is talking about CMV. We'll talk more specifically about that in a minute. So it's not really a huge health concern, right? You just have a virus. You feel really crummy, you've got a really bad cold, you go into the doctor, it's just a virus. They don't have drugs for viruses. Well, they do have a couple. They only have a few, and they save those for particular viruses that can make you really, really sick. Okay? So for most viruses, you get a rash, you get a fever, maybe you even have a seizure, but it's nothing to worry about. It's just a virus. What I'm going to demonstrate for you is that later in life, it's not just a virus, it's caused an autoimmune disease. Okay? So in the beginning, when it's just a virus, and you've gotten most of them as you were a baby or as you were a child, there's nothing to worry about. Until you get older, you've had a lot of stressors, you haven't really taken very good care of yourself, and now you're not healthy anymore. And you have all of these symptoms that nobody can explain, and it's not quite this disease and it's not that disease. They tell you that it's in your head, but truly you're developing an autoimmune disease that's linked to those viruses that are still in your body. These are some viruses that are tied to specific autoimmune diseases by some research. I'm going to point out a couple. Herpes 1 and herpes 2. You know what those are. Herpes 1, cold sores here. Herpes 2, in the genital area. Okay, you get blisters in the skin, lips, mouth, or genitals, and then the infection becomes latent for future reactivation. But it's been linked to MS. Oh, did you know that? If you get a lot of cold sores that are herpes 1, it's actually been linked to MS. Now, this isn't a complete chart because I'm going to tell you some other things in just a minute, but it's a great example of very common viruses that we think are no big deal, yet they prompt a great immune response in the body. So I'm going to go back to how those viruses replicate, because think about those cold sores. You've had a cold sore, that's a herpes 1, and it goes away. You get really stressed or you haven't been sleeping very well, and what happens? You start to get a tingle, you're starting to get a cold sore again. Darn it, the virus came back. You get the bad cold sore, that's that virus replicating till it explodes. Now you've got the cold sore, your body's got to get it back under control, and the cold sore goes away. But did you get rid of the virus? No. You still have the virus, and you're going to get another cold sore. Maybe in a week, maybe in a month, maybe in 6 months. I don't know when, but it comes back and it goes away. And it comes back and it goes away. I'm going to show you a whole list of viruses that do that same thing. You just don't get a cold sore to let you know that it's happening. It might be happening in your thyroid. It might be happening in your brain. It might be happening along your nerves that results in a different autoimmune disease. Latent infections are that virus that then goes dormant and then it comes back again. Okay, so it goes latent, it gets quiet, it settles down. Your immune system said, got it under control, and it just sits there. It sits in the cells and it's not replicating, and it's not doing anything until it gets triggered. And there's a variety of things that trigger it. I gave the example of stress, lack of sleep, when that cold sore comes back. But all of these herpes viruses, and there are actually 8 different herpes viruses. We talked about 1 and 2. The varicella is chickenpox. That's a herpes virus. And you know that that one goes latent and comes back as what? Comes back as shingles when that one gets reactivated. It can be Epstein-Barr. It's a herpes virus. Cytomegalovirus virus is CMV. Herpes 6, herpes 7. There's also Kaposi sarcoma and a bunch of other viruses too. They all go dormant and then they can come back. The reactivation can be included at any time, but another viral infection can trigger it. Some traumas can trigger it. Fever, even going through your menstrual cycle, or getting too much sunlight, or being on an antibiotic or something else can trigger it. Or maybe it's just doing it on its own. So this is my warning to you. Viruses are not safe. No one is safe from viruses. Let me prove it to you. Okay? The Epstein-Barr virus, EBV, that's mono. And actually, most of you probably have this virus in your body. And even if you tell me you never had mono, people get the virus without having all of the symptoms. It's been associated with a bunch of different cancers. EBV has been a causal link to cancer, listed here. And then it's also been linked to multiple sclerosis, Sjogren's syndrome, dermatitis, rheumatoid arthritis, lupus, and chronic fatigue. That's pretty powerful, don't you think? But yet it's just a teenage virus. You get it when you're young and it's no big deal. There's nothing to do for EBV, right? Wrong. There is a lot that you can do when somebody gets a virus. So this is actually a picture of my son Max, and he just turned 17 when he got mono. And you can't see it very well in these pictures, but his whole neck was just so swollen. This is super, super swollen, and his lymph nodes were all so swollen through his neck. He could barely move his head. He had classic symptoms, although he wasn't too terribly wiped out, and crossed my fingers as soon as he started to not feel well, and I said, oh my gosh, I think you have mono. No more sharing cups, no more kissing anybody. You have to keep your saliva to yourself or you're going to give it to somebody else. I did have him tested. Absolutely, he had an acute active form of mononucleosis, and I bombarded him with a lot of antivirals, and I'm going to tell you about some of those at the end. The reason I did that is because I wanted to minimize the effect that he was going through at that moment, and I know that it can cause thyroid problems. I know that it can cause MS. I know that it can cause other autoimmune diseases when he's 40 years old. And now was the time to minimize it, to squash it, to help the immune system get it under the best control possible. And I am hoping that I've made his risk or his chances of never getting one of those autoimmune diseases better when he gets older. So Anthony Williams has a great book out there, Epstein-Barr virus, chronic fatigue syndrome, and fibromyalgia. In his book, he documents 95% of today's thyroid problems, including Hashimoto's, are from EBV. 5% of those thyroid problems came from something else, radiation, from x-rays, dental exams, or even plane travel. Another from the CDC, okay, the Centers for Disease Control, report that 90% of the adult population have had EBV. They have antibodies to the EBV virus. Most of those probably never complained of having mono, but they already have the virus in their body. So the antibodies that show up on your thyroid test are there because they're fighting EBV. Okay? Now, again, this isn't the only thing that causes Hashimoto's, and maybe you have several things that have contributed to Hashimoto's. Myself, iodine, EBV, and mercury, absolutely, and then stress. 4 things that I know are related to causing my Hashimoto's. So EBV is a really, really strong indicator of Hashimoto's disease, and we have to try to get that back under control, because your body is making antibodies to try to fight the EBV, and it's causing more destruction in the thyroid gland. Now, EBV has a lot of research with MS. People with MS, so the myelin sheath around their nerves gets destroyed. And almost everyone with MS tests positive for EBV. People who don't have EBV never get MS. High levels of EBV antibodies precede MS symptoms and even flare-ups. So EBV flares up and the MS can flare up. So, and if you've actually had mono, it doubles your risk for getting MS. Yikes! That's really pretty scary, right? I think it is. This granuloma annulus, these little bumps on the back of this hand, I show you this because it's actually clustering of T cells that are part of your immune system that are fighting viruses. And you know what? Before I was even diagnosed with my Hashimoto's or my RA, or right around the same time, I remember getting these exact things along the lining of my fingers. So I used to get those bumps, and they'd kind of ache, and they'd kind of hurt. I asked doctors about it. They had no idea what it was. I asked an infectious disease doctor about it. He had no idea what it was. And I always thought at that time, I'm like, I think it's just my body, putting a virus in a specific spot and trying to attack it and get rid of it. And I was exactly right. So this condition is also found in or associated with diabetes, thyroid problems, autoimmune lupus, RA, and even Addison's disease. So it's your immune system fighting viruses, and you're seeing it in little clusters. This is another herpes virus, herpes 6. I'm showing you a picture of it right there. I'm going to show you more and just talk to you more about exactly what that is. So this is a child who has a rash associated with herpes 6, but it's been associated with MS, different cancers, and optic neuritis, seizures, epilepsy, which is a seizure disorder, fibromyalgia, AIDS, and chronic fatigue. The infection typically happens before the age of 3, and it's also known as roseola. So I'm going to go back one. This is a roseola rash on a child. No big deal. It's just a virus. The kid's going to get over it. He had a fever, and he felt tired, and he's going to be okay, and it all went away. Sometimes they can have fever seizures. Sometimes they can have swelling of the brain. And little is known about the prevalence of it or how it's acquired, but one study found that there are low levels in the saliva, so that might be one way that it's transferred. But look at this on the bottom. Herpes 6, at least the B strain, there's an A strain and a B strain, infects nearly 100%. 100% of human beings. Not of Americans, of human beings. So almost every single one of us gets this virus. That's pretty scary when it's associated with brain dysfunction. It can actually, in severe cases, cause disability and death. But look here on the bottom. It's recently been found in the uterus of women who have infertility. Oh, might be a virus problem if you can't get pregnant. The thyroid tissues of people with Hashimoto's. Oh, herpes 6 might be the problem in your thyroid. It's a trigger for MS and chronic fatigue syndrome. And then in brain biopsies of people with epilepsy that didn't respond to medications, it shows that the virus was playing a role there as well. Scary when 100% of us have the virus in our body. And then it's also been tied to several different autoimmune disorders, as I just mentioned. But specifically, I wanted to show you that when they've done fine needle aspirations from Hashimoto's people, so a fine needle aspiration from the thyroid, they found that 82% of those with Hashimoto's had herpes 6 in the thyroid, when only 10% of people without Hashimoto's had it in their thyroid. We got to target some viruses here, people, if you've got Hashimoto's, or if you've got MS, or if you've got RA. And then the third virus I think that I'm talking about tonight is a parvovirus. Look at this happy little boy. This is known as fifth disease or slap cheek syndrome. So you'll see little kids with very, very rosy cheeks. In fact, I think I have a picture of one of my twins standing next to his brother at the age of about 1. Looks exactly like this little boy, at least from the cheek standpoint. I don't think he had a body rash at the time, but this is fifth disease. So again, you get it when you're little, usually a mild illness. You usually get a little bit of a rash. It happens often in the springtime, and it's most prevalent in, in schools and daycares. You can get muscle aches or joint pain as well, and it's been, if she's pregnant, she can transfer it actually to the baby, and it can cause death of the baby. So pretty dangerous as well. 91% of Hashimoto's, subject to some PCR testing, had positive parvovirus, according to a study that Dr. David Brownstein did, compared to 44% of people who had a normal thyroid tissue. Definitely in the thyroid. So Hashimoto's, EBV, herpes 6, and parvovirus all found inside, not in the bloodstream, inside the thyroid. So many other autoimmune diseases are associated with parvovirus as well. It occurs most often in females, go figure. And then even autoimmune disease can develop even after an adult is exposed to a child with Fifth disease. So it can stir it up in an adult when you get exposed to this virus. You better get out of here because no one is safe from these viruses. They're so prevalent. We think they're no big deal. We should be taking better care of ourselves and targeting our immune systems and immune support and viral control when we get sick with these viruses to help decrease the prevalence of autoimmune disease later in life. At least that's my take on it. Thyroid nodules, think about those as well. We've talked a lot about thyroid nodules and iodine deficiency. That starts the process. But also think about viruses. If your body can't destroy the virus, it's going to wall it off in a calcium cage or a calcium prison. And sometimes those thyroid nodules are just that, a calcium prison for EBV cells. Or one of those other viruses that I mentioned that also get inside the thyroid. So the body isn't completely getting rid of the virus at that time, but it's trying to wall it off to limit its effect, but it still can drain the thyroid of its energy because it's not functioning as well as it should. And if the virus inside that nodule gets to reproduce and starts to grow, it can form a cyst as well. So what are some things that make viruses react or reactivate? Getting exposure to radiation, getting a blood transfusion, getting a vaccination, the flu shot, getting antibiotics, even taking ibuprofen or steroids, having a big trauma, exposure to other toxins and stressful events, anything that will stress out or suppress your immune system can reactivate these viruses. So what do you need to know about it? These are some general recommendations, some things that I keep in my house regularly. Monolaurin is found in coconut oil. You can also buy that in a supplement form. It can dissolve protective membranes because viruses protect themselves. And it can help to dissolve those so that your body can actually get at it and destroy the virus. Ionized calcium is disease fighting, and it won't allow herpes to flare. If you take calcium and lysine and zinc all together, if you're that person who gets those cold sores all the time, taking those three ingredients can knock out that herpes virus and stop it from coming back. And if you start to feel the tingle that you're going to have a flare of that herpes 1, starting the calcium, lysine, and zinc immediately can prevent you from getting the cold sore. Works like a charm. I don't get them, but my husband does, and he's done that regimen several times now, and then it's resulted in not getting the actual cold sore. IV nutrition and UV blood sterilization is a great option to wipe viruses out of your body. And vitamin C, of course, 3 grams or 3,000 milligrams a day is fantastic for boosting your immune system and helping you to fight viruses. I love silver. I've recommended that before when you get those cold symptoms. When I talked about 5 things to get rid of colds, silver, a silver spray or silver liquid can boost your immune system and get started on the fight against those viruses as well. Lysine is, I mentioned that on the previous page, and actually since 1978, they've proven that it has an antiviral effect. You can get some lysine from some foods that are listed here. High protein foods, nuts, red meat, eggs, milk, cheese, beans, and sardines all have some lysine in it to keep that ingredient readily available in your body, but it helps to wipe out that herpes simplex. That's 1 and 2. That's those cold sores. It can help to prevent and minimize shingles. HPV, which causes genital warts, it can work against that and genital herpes as well. And it can reduce the outbreaks and help you to heal faster. So get some lysine in the house if you have any problems with viruses. There are many other herbs and supplements out there that have antiviral properties. This list is some of them. You may be familiar with some of them. Licorice, astragalus, golden seal, your mushrooms, chaga and reishi, schisandra, Echinacea, I keep echinacea in the house, your glutathione. St. John's wort, which is traditionally used for depression, also is antiviral. We talked about zinc, there's cat's claw, selenium is fantastic, and selenium you need for your thyroid as well. Teas that give you EGCG, some green teas, even colostrum from breast milk is antiviral. That's why it is so important to breastfeed your children and breastfeed them for as long as you can. But what really is the goal here? I wanted to expose you. I want you to know and understand that it's real, that we get all these viruses when we're little, and they cause destruction and problems as we get older. So wherever we can minimize those viruses, it's important for us to get exposed to all different kinds of viruses and bacteria, but you want your body to be strong and you want your body to be able to limit those viruses, and you don't want those viruses to get reactivated. So when I work with somebody who has autoimmune disease, we need to decrease the viral load. We'll never be able to wipe it out 100% because those viruses hide. They get out of the bloodstream, they get inside the cells, and it's not always easy to reach them there. But then we want to boost the immune system, get the immune system strong and functioning normally, so when those viruses start to reproduce, it can take care of it and try to avoid the triggers to reactivate it. And using these steps can really improve putting an autoimmune disease into remission. And that's what I want to see happen for people. I hope you do too. And then that's the end of my presentation, I do believe. So I'm going to switch back to just me. And let's see, how long was that? 31 minutes. I'm classic for around 30 minutes. Can't go shorter, it seems. Trying not to go longer. I'm going to take a moment and look at some questions right here. And comments are blocking seeing your slides. I didn't know that you could even see the comments coming across your slides. So I apologize for that, Rhonda. I didn't even know that that happened at all, actually. But the slides will always be there, and you can always go back and look. And actually, when I've gone back and looked at things, I don't traditionally see the comments come across. So I'll have to look at that and see what I can do to improve that. Oh, Annie's given you some tips if you were watching it on the phone. Rhonda, can I make a suggestion? Because people are commenting you can't read what you put on the screen for us to see. Wonder if comments could be posted somehow, your live post. Okay, so I'm going to have to look at that. What are your thoughts on using high-dose intravenous vitamin C to kill stubborn viruses? Brian, it will be helpful. I don't know that you will ever wipe them out 100%, but definitely high doses of vitamin C in the IV form is fantastic and great for a lot of different cancer, infections, Lyme's, viruses for sure. So that's weird that everybody was that people were commenting on that, because I've never had that problem before. Yeah, Wheezy, varicella zoster came back 3 times this year as shingles. You gotta nip that in the bud, right? Rhonda says, I have low antibodies but high inflammation. What's a great way to lower inflammation? Whole nother talk, Rhonda, all about inflammation, whole other talk, because there's specific things that you need to do for inflammation that is different than viruses. And okay, I guess that's it. And I don't see a whole bunch of other comments. Now's your time to ask any other questions. Mary Burke says you can swipe comments away to see the slides. Fantastic. Thanks, Wheezy. Swipe the comments away so you can see the slides. Correction, swipe to the right. Okay. For the comments, I am able to see slide off and to the side and see the slides. Okay. Fantastic. Well, I'm glad that was the only issue. If you have any other thoughts or comments about viruses, let me know. And just got here, Karen says, yep, Karen, you're going to have to go back once we get done and look at about 3 slides from the end, and I give some suggestions about viruses there. How long do you continue the treatment? It depends what you're fighting. So that's a great question. If you're talking about the herpes cold sore, you treat it until it's gone and probably a week after, and then you start treating it again when it starts to come back. Unless you're that person who it's always coming back, then I'd stay on it for a prolonged period. For different people, if we're talking about we're treating viruses because of thyroid, I usually do it for a couple of months. to try to really drive down that viral load. But different people will require different lengths of time. So thanks for that question. That was a really good one. All right, guys. Well, it's time to go to bed. It's 5 after 9. I thank you so much for being here. Don't forget to share the videos. I hope you learned something, and I hope that you like the videos. If there's something else you want me to talk about, like someone brought up inflammation and we can talk about addressing CRP and homocysteine and different things like that, that's fantastic. Make sure to go to drkellyfelmer.com, check out what I have available there, sign up for some emails. You'll see postings from some of these videos as well as other articles, things like that. So hope to see you all again soon, and I thank you so much for being here tonight. Good night.